This is a very rich conversation, Dr. Henderson and Keisha, because right now in this country, we are seeing a complete uptick in cases of COVID-19. We are facing the worst increase that we've experienced since the beginning of the pandemic. And while attitudes may differ on how to deal with this issue, I don't think anyone at this point in time in history can ignore the fact that this is perhaps the greatest pandemic that we have faced in our lifetime. So, our conversation today about the issue of race and COVID-19 is a particularly timely conversation to have. But I want to start out by first going to Dr. Henderson to talk about why did you decide that it was important to do this report on COVID-19 and race? Was it about 6 months ago with the Black Public Defenders Association?
Yeah, I had the opportunity to, first of all, thanks for inviting me to my first ABA conference. I appreciate that. I see the way you all do what you do with its own unique platform. I'll take that back to criminology, so I appreciate that. For me, I think I had the opportunity to witness your work on a panel right when COVID first kicked off, and I said, you know what, her perspective, I think, is what we need in understanding the criminal legal system. And I knew that we needed to be able to collaborate with a body that had synergy and already understood that the importance of lived experiences as being central to making change. And so for me, I sent the email. I said, listen, collaboration is the way forward. And if we're ever going to fix this problem of injustice in our society, number one, it must come from people who share the lived experience with the oppressed. But two, it must be strategic. And in that strategy, we have to understand that at the end of the day, it's important that we're able to collaborate to solve these problems. That's what we need. You look at what's happening now. We're coming out of probably one of the most oppressive leaderships that we've ever seen. And I think we're going to have to begin to deconstruct a lot of the issues and challenges that we were working on long before this time, but we're moving forward now. And so for me, why I did this, why I felt this important, was because we knew that we had to have someone who had an understanding of the criminal legal system, but who also understood the need to represent the often disenfranchised and the historically discriminated against. So, Shakisha, you might want to chime in there.
Sure. Can you hear me?
Yes, we can hear you. Yes.
Okay, great. Hi, everyone. Thank you for joining. Thank you, April, for the invitation. And Dr. Henderson, it's wonderful to be on the panel with you again. For me, this issue hits painfully close to home. I am literally on the front lines as a public defender in the District of Columbia, where literally 99% of my clients are Black, and the vast majority of those are Black men. And what you may or may not know is that Black men are 6 times more likely than white men to be incarcerated and 4 times more likely to die from COVID. Those are the facts. And those facts hit me in my chest and in my heart back in May, when a 66-year-old client of ours, I manage the Prisoner and Reentry Legal Services Program for the Public Defender Service. So we get, hundreds of prisoner correspondents and family members, everyone reaching out when, COVID was new and people didn't really understand the impact that it would have. And a gentleman reached out, 66 years old, started showing symptoms of COVID. And I manage a team of attorneys. One of my attorneys got right on it. He drafted a brilliant compassionate release motion. Our city council had just passed that as an emergency law in the in the throes of COVID, literally before we were due to press send on the motion that Saturday morning, we were working up until Friday night. We got the call that our client died on a ventilator in the Bureau of Prisons. Our heart broke. He was fine until he got COVID. He died because of COVID, which is heartbreaking. And the majority of the people who are dying are Black people. The majority of the people who are incarcerated, as a Black woman, as a Black attorney, as someone who knows what it's like to weather disproportionate outcomes as a medical outcomes as a Black person, that hit close to home. And I made it my mission to arm defense attorneys with an arsenal of tools that they can use to try to save their clients and, for me, my people. And I can get into that a little bit more next time it's my turn to talk some of the measures and tools that people can use.
Oh, thanks. For me, what I found very interesting was that in these initial days, race was not central to the conversation of COVID-19 and the pandemic as it was marching through the country. We were watching TV, and at some point they began to talk about pre-existing conditions, and then my ears went up like, wait a minute, when they start talking pre-existing conditions, exactly who are they talking about? What do they mean? Why is this important? What's happening to these folks with these pre-existing conditions? And it wasn't a couple of weeks after that you started to see them saying, well, wait a minute. There's a Black folk that are dying across this country. And I said, wait a minute, Black people. And then they started seeing the nursing homes being ravaged all over the country. And I said, wait a minute, if nursing homes are in trouble, prisons have to be in trouble. Jails have to be in trouble because of the close proximity and the way in which disease moves through those sort of unsanitary spaces. And so I started thinking, you know what? If we don't get out in front of this and begin to attempt to control the narrative, then race will simply be another variable that they use in research, and they won't really get out and attempt to become proactive in keeping other Blacks, other Hispanics, other disenfranchised folks from dying unnecessarily, right? Just last week, we found out in Texas that 80% of the COVID jail deaths were of people who were there awaiting trial. I mean, so essentially, we're talking a death sentence for people who have not even been convicted of a charge. And many of those, in some instances, would not have been convicted if they had the opportunity to go through the process, which is unfortunate. Where are we? Are we in a better place than we were at the time in which we wrote this report? I'm not sure we are. The estimates are showing us that COVID-19 is about to get worse. We still have ravaged COVID-19 deaths in our community. There's still no definitive response to dealing with that. People are trying to help. The resources are just not there across the country. And I can speak for Texas. I can speak for places that we deal with in Florida, Chicago, Los Angeles. I don't know about D.C. You can give me an update on how that space is looking right now. But I know across the country, COVID-19 is still ravaging its way right through the minority community like it was day one.
When I first, back in, I feel like this is a documentary that we're still living. You know how documentaries start, right?
Right,
they go back,
exactly.
Take us back a few years ago. I'm like,
right, exactly.
June, and here it
exactly.
is November, right? So back in May, June, as Dr. Henderson said, we didn't have all the facts. Everyone's grasping, everyone's doing whatever they can to address the issue. And one of the first things I did was come up with an evaluation, if you will, a questionnaire for defense attorneys to ask their clients about their conditions in the jail, in the prisons, which helped the foundation for a lawsuit that my agency and ACLU did But I wanted to do more, and I remember being approached like, hey, maybe you can write an article. I remember saying and thinking at the time, is this really going to be an issue in September? Because this article was going to be coming out in the fall. I said, I just don't know if this information will be right come September, October. And they said, no, write it. I think it will be. Boy, was I wrong, because Dr. Henderson is right. We are worse off now than we were back in May, June. And so I wrote an article. I'm going to share my screen now. Tell me if you all are still able to hear me. Dr. Henderson, can you hear me?
Yes, I can. Yes.
And you see me sharing my screen?
Yes, I can. Yes.
All right, wonderful. Nice to know technology is working. So I wrote this.
That's it.
Oh. I wrote this article. It just got published in the ABA's Criminal Justice Magazine, and it's called "Defense Attorneys Are the Best Line of Defense Against COVID-19 Pandemic for Incarcerated People." And it really is true. We are the ones who hear directly from our clients and our family members who get the first information about their conditions as well as symptoms. But in order to really start protecting clients, people need to know what the science says, what they should be looking out for, and what are some steps that they can take at the various stages of litigation. So the very first thing that the article did was talk about advocating for release, right? And I'm going to go right to that section. And for, folks on this panel discussion, I literally thought, based off all my years of experience, what is every way possible that we can try to get someone released? And I also sought input from my colleagues. I said, email me everything, nothing is too large or small. And, this is a comprehensive list that we came up with that people can read this article all around the country and check against, hey, am I doing this pre-trial, right? Did I ask for bond bail review requests, motion to modify custody, request release pending trial, request release with conditions, request halfway house placement. At the time, that became one of our biggest tools was halfway house placement, and they started getting granted, as well as home confinement, right? Things that people didn't always traditionally use a lot of times or didn't think was necessarily going to have traction. We started dusting off the statute books and finding everything. Seek transfer to juvenile court for children charged as adults. Pretrial litigation to dismiss the case. Even at sentencing, right? Request delayed imposition of sentence. We saw that with Michael Avenatti, right? The famous lawyer who was going against Donald Trump in the pornographic case. He essentially got delayed imposition of sentence. Request time served. Request probation, request a suspended sentence, request work release, request jail on weekends. We saw many of our clients getting these type of sentences. But the bread and butter lately for our work has been post-conviction, right? We've been filing tons of sentence reduction motions. In DC, they're called Rule 35. Requested release on parole. We did a mass request in the beginning, asked release for 60 people. We've filed over 100 compassionate release motions. We got about a third granted. I think we're at maybe upwards of 200 now. Request for geriatric parole, medical parole, request for release to home confinement, request for release to halfway house, request for a prison furlough, ensure confirmed good time credits. In DC, after COVID, our DC Council passed a good time credits legislation, emergency legislation, which afforded more good time credits for misdemeanors, people serving misdemeanor sentences in the jail, as well as people serving felony sentences in the BOP, making people immediately available for ready for release, qualifying them for release or qualifying them for a parole hearing, as well as habeas petitions, which we filed. And so you may look at this list like, oh, this is just a list. Will it really work? I can tell you, yes, it's working. This is what we put into practice. But then separate from that, I armed defense attorneys with the help of Dr. Jamie Meyer, who's an associate medical professor and who works on infectious diseases at Yale. Hey, what should defense attorneys be looking at? So in the article, it talks about best practices for preventing the spread, appropriate protocol. What should institutions be doing? What should you be looking out for? Do they have the requisite PPE? What are the stats in your particular jurisdiction? What is normal in your jurisdiction? If your client does come up positive, what kind of medical care should they be getting? When should they be hospitalized? Because we know just from watching the news, you've heard names like Regeneron or Recidivir. I don't think I'm saying the name right, but many of these medications are intravenous and need to be given in a hospital, and that is likely to increase the chance of survival. These are things that this article goes really in depth into to arm defense attorneys with all this information so that they really know how to protect their clients. I don't know if you guys were able to see all that. I'm still maneuvering the technology. Oh, wait, I don't hear you, Howard.
Okay, can you hear me now?
Yes.
Okay. I think, I want to speak for a moment about, why it was important for Black researchers to be a part of this conversation. And this comes out of the reality that, we recognized some time ago that when you look at the research that's out there, many of the questions that they ask don't necessarily get at the issues that Blacks face in the community. And, systematically you begin to question whether or not that's intentional. And then you get back to the reality that it doesn't matter so much that it's intentional. The effect is still the same. And how do we fix it? And so we put together a team of researchers who've been around now a couple of years at historically Black colleges to begin to push to train and provide opportunities for Black researchers. And why that was important, because we recognize that COVID-19 had created a space for serious conversation about public health in the Black community. And when you have a conversation about public health, you must have people in that conversation who share their lived experience. I mean, when you look at the Black residents in Washington, D.C., for example, they accounted for almost 80% of the deaths as a result of COVID, but also almost that many percentage-wise in terms of total arrests. So not only were Blacks are Blacks more likely to be arrested, we're also more likely to be to die from COVID-19, which was a disturbing relationship that we knew was deadly and had the potential to decimate minority communities. But the questions weren't being asked, and they still aren't being asked by people who don't understand this particular perspective, this way of life, this reality. And we realized that the situation demanded that there be a racially equitable response. I mean, race neutrality does not exist, and we understand that from a research standpoint. The research showed us that when you look at, for example, the National Institute of Health research, they realized that community level research is unlikely to be funded. And they also realized that Black researchers are more likely to do community level research, which by default means that the research that we need in the community, which is more likely to be done by Black researchers, isn't funded by major organizations around the country that are designed to do research. So there's a systematic problem there. And if we don't have the data, how can we make arguments for the solutions? How can we identify the solutions? So the legal community, you all are doing your job working with these folks every day in and out, but the data is not being provided for you to make these decisions and make these arguments. When you go back and you look at what it was that made Thurgood Marshall so successful, he had a team of researchers who was able to provide him the empirical support to support his legal arguments. And it's almost impossible to beat that combination. And so I think that, the work that you all are doing is so powerful, because if you aren't at the table, they aren't making these arguments for our community. And so we need to be able to have these conversations on every issue that comes up. When you look at other organizations, when you look at other racial ethnic groups, every issue there's somebody stepping up talking about how that impacts that community. We don't have that necessarily in the Black community, someone who speaks up every time there's an issue about how the issue impacts our community. And so hopefully this relationship that's been sealed in this first report will continue moving forward, and we need to make sure that continues.
Well, let me add to this, because it is a relationship. I started off by empowering you all with all the tools that lawyers could be doing, right? That was the beginning. Now we're rocking and rolling, and we're not playing games when it comes to race. So those compassionate release motions I was telling you about, every motion, when you're talking about the vulnerabilities to COVID, the underlying conditions, there's an entire section, every motion that one of my attorneys files, that talks about race.
Okay.
The impact of race. Where does that information come from? It comes from the research that people like Dr. Henderson are doing. If we didn't have the benefit of that research, we wouldn't be able to put it into our motions. And they've been powerful, and they've been having an impact. And that's why we're getting people out left and right, because we're talking about, look, this person has diabetes, they have hypertension, they're in an institution where the rates are really high, and they're Black. And that's something that you can't ignore, making them 4 times as likely to die from this deadly disease. And so I thank Dr. Henderson for his work, because it empowers us on the front lines to use that information to benefit clients, and frankly, to educate decision makers.
Hey, Dr. Hender, I just want to flag, you all are like vibing and doing great. I was miraculously let back in. And so I just wanted to say, I do want to, Dr. Henderson, you made the point, but I just want to say it again. Like, I want a t-shirt to say racially neutral policies to address historic racism is harming Black and brown communities. I just wish we could have a bumper sticker, because we learned from the opening session, when you have institutions who are embedded with racial inequities, and then we oftentimes hear, well, the policies are not racist because they're race neutral. Can just somebody speak to the fact that that is actually not true, like how race neutral policies actually cause harm?
Okay, so let me speak to it from a scientific standpoint, if I can. Racism leads to science that is biased, exclusionary, harmful. And the perception is that science is supposed to be unbiased and objective. The backgrounds of the researchers, the experiences, the perspectives of the individuals who are actually doing the research, but cultural ideas about people, right? How you think about people, how you perceive them, the composition of research teams, all of that impacts the kind of issues that we research, the kind of questions that we ask. As I stated earlier, who gets supported financially, and even who is represented as a part of the research team. I mean, when you think about facial recognition software, for example, and metadata that they use from photos that are taken of people at protests, right? They found that there is a higher rate of false positive matches for people who are Asian and African American over faces that are white, sometimes by 10 to 100 times greater. That is due to the training that was utilized to create the algorithm on primarily white faces. So structural racism is pervasive in research as it is in the legal profession, right? And so we have a historical legacy of deep-rooted racism in all of our policies, in all of our laws, in all of our... There is no American institution that does not have deeply rooted racism in it. And so to assume that the solution can be non-racial and non-focused is absurd, right? And unfortunately, what you're saying, April, many people are afraid to say, right? And we need to question why they're afraid to say it. But I think what you all have been able to do is bring together some of the brightest, most experienced legal minds to say we can deal with this because not only do we have the lived experience, but we also have the academic credentials and the know-how. And that combination is uncommon, right? When you meet people who work in our community, a lot of times they don't come from the community. So there are questions that you can ask that other people find it politically incorrect to ask. There are solutions that you can come away with. For example, Houston is experiencing a violent crime increase, drastic. And the mayor, who happens to be black, the news interviewed him and said, Mayor, what do you have to say about it? He said, look, y'all need to sit down somewhere. That's a black folks way of saying chill out, right? And people get that. So I think that, if we keep pushing for the reality that it's okay to say that racism exists, it's okay to recognize that, and it's also okay to have racially specific solutions, right? We have allowed the civil rights movement to make us think we can no longer go back and say there are things that are better for black people. We know the answer to that. But I'll digress right there for a moment. But thanks for raising that question.
So, Dr. Henderson talks about the data, the research, the science. It's like they say, do I believe you or my lying eyes? I know what I see. And what I see when this happened was, the DOJ under Attorney General Barr issued guidance, the Barr memo, when COVID first hit on home confinement. And I remember thinking, trying to figure it out, digest the new law. What does the request look like? Start doing some research. The first request I find is for Paul Manafort. We all know who Paul Manafort is. The letter ended up online. He's released on home confinement. 7-year felony conviction. Next up, Michael Avenatti. Already mentioned him. His case was just stopped mid-sentence. Oh, God, we can't afford you to die from this. We're going to let you out. He's facing 20 years. We'll get back to you when this pandemic thing figures itself out. Next up was Michael Cohen, serving 3.5, 4-year felony sentence in the Bureau of Prisons. Out, home confinement. My black clients, similar sentences. I'm pleading in making the case for why their life matters. Because that's where the racism comes in. You have to see the black body, the black family, worthy of life. The governor of, I think it was Maryland, he's since changed his tune. Article just came out in the Post yesterday where they're going to be releasing 1,200 people. But originally he said they're safer in prison. They're safer from the pandemic in prison. And I would propose that part of that, and there's lots of research on this, back to research, how black life is viewed and the devaluation of black life and literally black bodies and black families, such that we hope and pray that you somehow survive this. And if you don't, I don't know if you guys heard this new term of art for people who go to prison. Organizations have started to say that they're disappeared. I heard that recently at a conference because it's true. In a sense, you're disappeared from the community. You're disappeared from the family. And black people have been incarcerated for so long and it's become a part of the American psyche that we are emotionally divorced from it. Such that whether they disappear by incarceration or they disappear by, mass shootings in the community or they disappear from COVID, it's 6 and 1, half dozen the other. But when we think that Paul Manafort, Michael Cohen, or Michael Avenatti may have the grave misfortune of dying from a microscopic coronavirus, well then no, for that person, we have to get them out because their life values. A prison sentence shouldn't equal a death sentence for them. That is race. It may not be explicit, but it's my experience. And it's what history shows us. So yes, April, I think you're spot on when you say you have to talk about race. You have to identify the disparities. I'm passionate about this.
Well, actually, Keisha, I think you raise a really good point that I want to highlight. And I don't know if you all talked about it, but we definitely, when we talked about issuing this report, was that it was an opportunity. COVID-19 presented the perfect storm to literally uncover everything. So even when you say they're safer inside, like in jail, because that's a recognition of the failed public health systems that exist in most brown and black communities. It's the recognition conditions without access to health care. So when people say you're better off inside, I think it exposes the deep racial inequities that people return home to. So I wanted to kind of highlight a few of our recommendations because our report is very clear about what is needed in order for people to create racially responsive strategies. And we talk a lot about reentry. We talk about cash benefits. We talk about making sure when people are released to the communities that they don't go home and make the communities worse off. And so if somebody want to talk a little bit about how COVID-19 actually presents the opportunity for policymakers to de-incarcerate, increase access to quality public health, and also re-up and strengthen our reentry support services.
Yeah, I'm going to try to share my screen here for a second. Let's see if this works. Okay. So here up are some of the recommendations that came out of the COVID-19 race paper. And so, like April just said, 4 recommendations for reducing prison populations and racial disparities in incarceration. First is it provides opportunities for a second look at long sentences. And this movement is growing. Second look sentencing, it's called. And this basically recognizes that we incarcerate the most amount of people in the world, that we have devalued life, the vast majority of which is Black and brown lives, and that history, here we go again with the research. Research actually shows us for many people who commit crimes when they're young, usually before the age of 25, that they tend to age out of the system after a certain amount of time, anywhere from 15 to 20 years. And that as people get older, they're less likely to commit violent offenses, especially if they've rehabilitated while incarcerated, and their programming, and they have various supports in place, family, reentry services, etc., and that we should move away from these draconian mandatory minimum, convicted of selling crack cocaine, you get 30, 40, 50 years life, and that really we should start to review your sentence and your rehabilitation after 15 or 20 years. And that movement is growing across the country. We have a movement in D.C. We passed what is called IRA, the Incarceration Reduction Amendment Act, 1 and 2. Is being discussed more. This is for people who are under 18. And it's also, recognized, various groups have looked into this. And so I would recommend that. Also, second recommendation is stop excluding violent offenses from reforms. That's also another movement which disproportionately, again, affects Black and brown people, or just this idea that you're not redeemable. Even if you have been convicted of a violent offense, again, back to the research, after a certain point, you're not the person you were at 22, and that you are worthy, for lack of a better word, as determined by society, to come back into society. You've been rehabilitated, and you can contribute, and society could in turn get something from you, right? It's not just a one-way relationship. We know that communities and families are damaged and broken when members of the community or family are taken out. So that's a critical recommendation. Third, eliminate mandatory minimums and other mandatory sentencing laws that are harmful to Black communities. There's a growing movement on that. Again, in DC, that came out of the recent Sentencing Commission's recommendations was to do away with mandatory minimums. The good time legislation that I mentioned earlier on this conference, there's a provision that allows, there was a time where you didn't get any good time off of the mandatory minimum portion of the sentence, and people had to do what is called day for day. Now we recognize that that's harmful, and people will get good time off the mandatory minimum portion of their sentence, making many people immediately qualified for parole consideration, which is major. And then finally, implement racial impact statements for decarceration efforts. And that's essentially bringing race into everything and recognizing the impact that race will have on whatever the decarceration effort is. Finally, we have recommendations for mitigating the health disparities in the criminal legal system. First, we should increase funding to community-based support resources that help alleviate health disparities for those most likely to come into contact with the criminal legal system. And that's what April was talking about, right? We're coming out and they don't find themselves being recycled throughout the system. We should, number two, eliminate medical co-pays and increase employee wages for incarcerated people. Many negative outcomes come with the negative work environment for people who work inside of prisons. And so that's an ongoing issue. Collaboration, number three, between public health institutions and criminal legal system stakeholders. Intersectionality is so important, and we must recognize and address that. And then fourth, reducing the prison and jail population is in the interest of public health. That used to be, a simple sentence that people said. It was theoretical. But like April said, now that COVID happened, is no longer theoretical. A public health crisis is a crisis in the prison, and a crisis in the prison is a public health crisis for everyone who's out, because people come and go all the time, especially in jails, and people who work there.
Thank you, Keisha, because we really wanted to highlight and make sure we push forward as much as possible these very concrete recommendations. We need to make sure the next administration has our report, because I think it's some really good, sound recommendations in there that could be picked up through administrative actions, even through, Bureau of Prison Policies and other things in the federal system. So something for us to think about. I want to see if anyone has questions from the audience. I know we have a group of people. If people have any concrete questions, feel free to put them in the chat menu or send it to us through question and answer. Is it anything else, Dr. Henderson, that you wanted to add regarding, our recommendations, or really, because we want to leave people with concrete steps on what can be done in their local communities?
Right. I think that, the recommendations are solid. I still get good feedback from people around the country, but I think if I had to identify a recommendation that I feel is like one that would really be like game changing, all of them would, but I go back to the recommendation of the violent crime piece and understanding how significant that is to reducing not only the jail population, but the responses to individuals who have been charged and are convicted with those offenses in our community. But I also recognize that's not enough, right? We need individuals in our system who work in our system, advocacy groups, as well as the community, to begin to reject this notion that harsh punishment is the answer to our issues, right? And ultimately, we need to be able to decriminalize, let's be honest, being Black. And when you look around the country, we still have a reality that we kind of gloss over. But the community is going to have to demand that we're going to demand that of law enforcement, our governors, our prosecutors, our public defenders, our academics. We're going to have to expand what we know to be low-hanging fruit in this reformatory movement. And we're going to have to be able to create a priority list that can allow us to make changes and doesn't cost us much money because, they tie us up in the fiscal arguments. But I think that we're going to have to focus on sincere, concrete, genuine reforms that will require us to rethink how we deal with crime in this society, recognizing that it is a direct outgrowth of the plantation and its system of justice. So,
Yeah, absolutely. I wanted to see if the audience, if anybody, if you could just write yes or no in the chat menu, whether or not your local community has developed a racially responsive response, like whether or not in your local community there has been targeted policies towards communities of color, or if you're in a jurisdiction, it may be another group who is disproportionately impacted, whether or not you've seen any targeting of policies and responses in your community. I'm just curious to know, because even as we say it, I know Keisha and I, we're in the Washington, D.C. area, and I don't necessarily see targeted response around COVID-19, although 80 to 85% of people dying are African Americans. I do see access to testing in the communities, but whether or not it's a targeted community communication strategy and resources, I don't see that in our local community. Okay. So I wanted to, I wanted to kind of follow up. I know we issued our report about what responses are needed for COVID-19 and race, but one issue that's really been on my heart because we've seen an uptick in violent crime. I'll just say in my community because I can kind of hear it at night, right? I hear gunshots. I hear, and I see on the community listserv like an uptick in crime, and I really want to talk about it. What is needed to help everyone deal with COVID-19 and the mental health impact of it, but specifically for communities who already, when you talk about COVID-19 taking away job opportunities and how it's impacting different communities around education, all of those issues are compounded for communities of color. So what should be the kind of mental health response or public health response to what I think is a crisis that people are not dealing with, that is manifesting itself through behavior that's harmful to community. So I'm just wondering if you all have any thoughts about access to really dealing with the mental health component of the COVID-19 pandemic on the Black community. And let me just say, at this point, I have very few friends who have not had loved ones lost to COVID-19. I just buried my cousin Saturday from COVID-19, right? So just the impact of it, how, what resources are needed for the Black community to deal with the fact that this disease is ripping our community apart and nobody seems to really be talking about it.
Is it okay if I go ahead and jump in here on this one? Okay. So, I think that we need leadership and we need community engagement that understands the balance between the risk associated with the help and the factors that lead us to be in this position. So lack of income, access to basic services, no social safety net, food insecurities. Ultimately, we need people who are going to be very pragmatic and they're able to balance the local structures and the systems that are already in place. Social mobilization, community engagement, I think, are the key. The problem is they're so fractured, right now, right? We should be able to. I mean, just the whole concept of homelessness is an example of this. While many have excess, few suffer because they don't have access to what most people throw away. We're going to have to situate all of this into a humanitarian crisis, right? I just saw 2 days ago, Doctors Without Borders was on their way to El Paso, Texas, and that's a third world approach, okay? And I thought to myself, watching this on the news, there are folks in this country that have been in the third world, right? And I think that we're going to have to continue to make it known, because we get silent, right? We get complacent because we have a job and everything is okay. We got cable, got a cell phone, so we have some of the amenities of luxury. But we need to not forget, putting this information out, that there's a humanitarian crisis that we're facing, and we need leadership that understands that in all of these humanitarian efforts, the development of the infrastructure at all operational levels within these communities by local authorities is what we need, because this is a pandemic, right? This isn't the flu, right? This is something where the ability to spread is unlike we've ever seen before, and it's killing us off in mass numbers. And so we're going to need somebody to step up and take leadership of ownership of this crisis and say, look, I don't care what you think. We're going to lock this thing. We're going to lock it down for whatever we have to do, because they're hedging their bets on our lives. And I think we need people who say, you know what? Sometimes you just got to listen. I got 2 young kids, and there's sometimes when I say, you know what? I don't care what you think today. This is the best thing for you. We don't know. I'm not a medical doctor. I don't know what's best. I know that quarantining myself and staying away from people gives me a chance, right? So we need leadership that can say, you know what, y'all? I don't care if you want to go to work. I don't care if your boss tells you to come to work. Let me deal with him. We're going to shut this down for however long it takes to shut this down, because they're estimating losing almost 200,000 more people by the end of spring. And I know the first couple of months of COVID-19, it didn't touch my family. But I know over the last few weeks, I've lost 3 people. So it's getting closer, right? And I'm like, wait a minute, this is not okay, because when people are dying, that's a whole different ballgame, right? And so we just need leadership who says, look, y'all, I don't care what you think. I don't care what you want to do. We're going to lock it down like we should have in the beginning. And nobody's going anywhere without a mask, right? Nobody's going anywhere that could be a super spreader event. We're not going to have graduations. We're not going to have church. You can go to the grocery store and you can go home. So
let me get real for a second. You guys can always count on me to keep it real. Yes, we need leadership. Dr. Henderson is right about that. But we also need to save ourselves. We need to save ourselves, because this is as old as time. There are a lot of people and there's a little bit of resources. And so when there's not that many resources, we start to make cuts, right? Whether you call it survival of the fittest, Darwinism, whatever human sociological case study you want to talk about for the last several centuries, somebody's at the bottom, somebody's at the top. What do you always talk about, April's social dominance theory?
That was our introduction keynotes, race and social dominance.
Social dominance is real. Like, this is great on this little Zoom call, but in real life, if it's me or you, it's you, not me, right? I mean, it's innate to our nature. And so while no one may say this out loud, it's convenient. We had leadership literally look at us in the face and say at a press conference that we should do, what do they call it?
Herd immunity.
Herd, but he didn't say herd. He said something else, but herd immunity. like basically everybody die until we get immune. Whoever's left is left. And if the people at the bottom of that social hierarchy is black people, brown people, we won't say out loud that that's our goal, but hey, we were all trying to get our feet under us and figure this thing out. And I'm sorry that your community and black people took the brunt of it. And so I say that to say we have to literally be in these streets. And that's what we're doing in DC. The community service providers, the long-term people, they're literally in the community educating people. This is what social distance means. Here's PPE. You can't afford it? Don't worry about it. We have you. You need hand sanitizer? We have you. You need masks, not just for yourself, but for your mom and for your girlfriend and for your sister. Here's 10. Here's a kit to keep you going. And we're going to meet you and find you where you are, in the halfway house, on the street, in the jails. We are going to do what we've been doing for our community for as long as time, and that is helping ourselves. It's happening in the church. It's happening on the streets. It's happening everywhere, because social science tells us that it's not necessarily in everyone's interest for everyone to survive. I know that sounds uncomfortable to say. I know that sounds like, who would really say that? But it's true. And so it's not an either or proposition. We must do both. And that started with the work of this COVID-19 paper to educate ourselves and to educate our communities and to save ourselves. And then we must simultaneously keep putting the pressure on our leadership to do their job, which is to protect all of us.
Yeah, I think it's correct. One thing about the issues of race and social dominance, or how racism plays out in society, nobody really wants to say it, but your phrase that my eyes don't lie to me, like if you ask anybody who is working in hospital units, who is in hospitals dying from the disease, right? If you ask anyone about who has access to tests to get knowledge that you have it early, where you can get treatment and where you can increase your likelihood, and those same resources are not available in our communities, and they disproportionately impact communities of color. So we're 5 minutes out. So I just want to give people an opportunity. If you have not, I am going to try my best. Keisha, I have had so many issues with this platform. You may want to drop a link to the report, or people can find it at blackdefender.org. And Dr. Henderson, where is it housed on your website?
Yeah, centerforjusticeresearch.org. But hey, as long as they get it, it's fine. Centerforjusticeresearch.org. And we just need people to check out the facts that are there, the recommendations, and I think we'll be in a better place.
Yep, absolutely. Any closing thoughts that you all want to leave with the audience today? And I didn't get a chance to say thank you, but I know the world is very busy and heavy right now. So thank you for coming to join us today. The really good thing about that, it being a virtual event, is that our programming will be made available on the ABA YouTube channel, and people can, press replay and watch it again, because all of the sessions are being recorded. So I just want to say thank you all for coming to share your knowledge and expertise with the ABA community.
Thank you for having us, April, and thank you for your leadership, and thank you to everyone who's on the call, because the first step is you got to care about race. Because when you don't care, and it's out of sight, and it's out of mind, and it's not your issue, then it's easy for it, like I said, for it to disappear into the background. But when you do the uncomfortable work, and you face it, and you say, I'm going to attend the session on race. I'm going to host a session on race. I'm going to issue a paper on race. I'm going to talk about race in my motions. I'm going to talk about race to the judges. I'm going to talk about race everywhere I go. That's the first start, because it makes people have to face it. And when you face it, then you come up with solutions to deal with it.
Absolutely.
Yeah. Listen, April, Shakisha, thank you guys so much for, the opportunity to present with you again. I think that, we got to keep fighting this fight, because here's the thing. Racism isn't going to last forever. We just got to figure out if we want to get it done in our lifetime or not. The slavery ended. This will end at some point. We just got to figure out how long we're going to let it stay around, and we want to be a part of that movement. So thank you so much for allowing me to have this conversation with you. I appreciate it.
Thank you, Dr. Henderson. I think you inspired me. I never thought of it that way. Nothing lasts forever, and it will end one day. The question is, will we have the courage and the leadership in order to do it in our lifetime?
Do we think we see a black president or a black vice president? You just never know.
Correct. All right. Well, thank you all. Thanks to everybody who has joined us today. And you can check out the report, Save Black Lives, at blackdefender.org or the Center for Justice Research.org. And Carol, I think that is the end of our panel, so you can close us out.